Meet Bobby and Simon. They are the FRIIIs looking after female and male admission wards today. They both are looking after patients with diabetic ketoacidosis. Both their patients are now better. They are eating and drinking. DKA is now resolved. Bobby and Simon are waiting for Dr. Smith's ward rounds. Dr. Smith suggested stopping fixed-rate intravenous insulin infusion and switching back to regular subcutaneous insulin for both the patients. Simon stopped the intravenous insulin at 9 a.m. and prescribed the regular subcutaneous insulin. However, the next mealtime and background insulin were not due for hours. Bobby's patient was already on background insulin, along with insulin infusion. He restarted regular subcutaneous insulin with the lunch, and stopped insulin infusion after 30 minutes. By 5 p.m., Bobby's patient was ready to go home, whereas Simon's patient was feeling unwell, with raised blood glucose and blood ketone levels. So, Simon, what went wrong? Simon, did you restart regular insulin correctly before stopping insulin infusion? Patient is normally on basal bolus regimen. This would mean quick-acting insulin with each meal, and a background insulin. Simon stopped the regular insulin regimen and started insulin infusion. This kept the blood glucose levels stable. When DKA resolved, Simon stopped the insulin infusion, but patient's mealtime and background insulin were not due for hours. Remember, half-life of intravenous insulin is only 5 minutes. Stopping intravenous insulin without restarting regular subcutaneous insulin will put the patient at risk of rebound hyperglycemia and ketosis. So, what did Bobby do? Bobby stopped the regular mealtime insulin but continued the background insulin, along with insulin infusion. This kept the blood glucose levels stable. When DKA resolved, he continued insulin infusion until 30 minutes after the regular mealtime insulin was given and patient had eaten. This provided insulin cover and kept the blood sugars stable. So Simon, what would you do differently? That is correct. If a patient is on background insulin prior to DKA, continue this whilst on fixed-rate intravenous insulin infusion. Stop insulin infusion only 30 to 60 minutes after the administration of the regular quick-acting insulin with a meal.